Hi everyone, welcome to my channel. So in this video we are going to continue with the last part of video. So here it is in transcultural society in nursing we are going to see. So transcultural nursing and what are the main components, this is a topic we are going to continue in this video. So the main thing is it is enforced the need for the social change, and this diversity has created a great challenges for nurses as they must provide individualized and comprehensive care. When a staff nurse or when a nurse is clearly understood about the person's individual culture and cultural behavior, what are the practices they are giving, it helps to give them a comprehensive care. And nurses may encounter patients from numerous culture in daily practices, so it is very mandatory to know about this, what they have practicing in their daily life. Next, this transcultural nursing concept is given by Leninger in 1978, which helps to develop culture care theory. So this is an ongoing process, and this also helps to work effectively with culturally diverse persons. And it also helps the keen awareness of diversity and strong knowledge based and skill in the transcultural nursing, and mainly it focuses on professional respect for others. When they gain more knowledge about the ethics principles of an individual person, it helps to understand uh, what they personally and professionally thinks. So it helps to identify what the basic need is and how to give a care. So there are six cultural components model in transcultural nursing. First one is awareness, skill, knowledge, encounter, desire, and assessment. So we will be deeply seeing this in the next slide. Awareness. So awareness is a nurse should know the patient's own cultural values, attitude, and belief. Then skill is to conduct cultural assessment in a sensitive manner. It can be questionary manner or any other manner, but it should not cause any harm to the patient. When it comes to knowledge, if a patient belongs to a particular culture, what are the rituals or what are the principles or what are the ethics they follow, what is harm to them, it should be clearly identified by the nurse. Encounter is congruent with the cultural ways. Take the patient care with a cultural way. Desire is enthusiastic about the learning other cultural ways and integrate them into a nursing care plan. More they know, they can incorporate in the nursing care plan. Assessment is nurses must perform self-assessment to determine whether they are actually and culturally competent with the nursing care. It helps the nurses to develop a better care for the patient. So nursing strategies for culturally competent care. So the main thing here it comes is interaction. When they talk with patient or when they interact more with patient, they have a ability or they have a capacity to understand what the patient think. And nurses should not pose open-ended question. It should be like the answer should be very easy uh, for the patient to deliver. How will you follow this practices? So this is a question where we can ask to the patient. Patient cultural beliefs and values are related to the health. This plays an important role in the healthcare settings. Then she should be familiar with appropriate verbal, non-verbal communications like silence, touch, eye-to-eye contact, distance, space. These are all the main thing plays an important role in communication of patient. So care plan is nothing but nurses should make an effort to include belief and practices of various cultural into the nursing, and this is also helpful in a neutral cultural practices and discourage those that they are dysfunctional, harmful to the health, suggestion alternatives, which are all the things that will cause harmness or discomfort to the patient. It should not be suggested. We have to search for an alternative and accommodate cultural dietary practices for inpatient and help families to adapt. Which means, for example, when an Brahmin patients come, or when an patients come to the hospital, if their dietary practices are not going to take some certain amount of veggies or something, we should able to identify and we should give the dietary practices. Then respect the patient regardlessness of cultural background. Regards other than the cultural background, in person we have to respect the patient. And what are the benefits and challenges? So main advantages: effective nursing care within the cultural convenience of their patients, then patient satisfaction and provide health outcome, then true respect and concern for the patient, making patient confident that they are being cared for. So the main problem with transculturalism is conflict between the cultural leading and dilemma in the society. They have their own thoughts or knowledge about their cultural beliefs, so it should not lead to a conflict between the patient and the nurse. But this is mainly happening in the society, creating a conflict between traditional and modern ideals and cultures. uh, the main problem in India is cited as transcultural society people, where they are from different religion, caste, and cultural live together. So mostly this problem could be avoided, but still overall from the thing that they believe the culture very strictly, this conflicts may arise. So ideas and modern ideas is the main thing which bring patients conflict together. When a nurse is very clear and particular about the cultural ideas, it could help her to make the nursing process better. Thank you.